Welcome back. This is the Ben Shapiro Show. Our number 855-236-3228, 855-236-3228. Taking your calls because we are hanging out together. Mark in Adamsville, Indiana. You're on the Ben Shapiro Show. Go for it, Mark.
Hi, Ben. I had a question. With all of the coronavirus lockdown stuff going on, and I'm sure you've read about the police ticketing people in Kentucky for going to church services. I've read a lot of sentiment online where, people are basically siding with the police and saying this is okay. You have extremes on both sides, but my opinion of it is Nazi Germany, they were following orders whenever they were asking people for papers. That doesn't make it right. Do you think that this country has gone too far, and can we turn it back around? And if so, what would you say to the people that are agreeing with these policies, saying, "Hey, everybody just needs to stay inside"?
I never like making. Mark, I never like making Nazi comparisons just because the Nazis were also engaged in tremendous human rights violations, including mass murder of human beings. But
absolutely.
When it comes to petty authoritarianism, when it comes to petty authoritarians at the local level who are using the opportunity of a lockdown to sort of flex their muscle, giving people $1,000 fines for walking around on a beach alone with no mask. Come on. Like that stuff obviously ought to be out of bounds and is ridiculous. As far as the long-term lockdown here, you can hear I've been willing to grant a certain amount of legitimacy to government doing this stuff for public health benefit, but they need to spell out a plan. They won't even explain to us what kind of data they are missing. I'm okay with hearing the plan, and then we can debate the plan. We can talk about, okay, what data do you need? How long is it going to take to gather that data? Now we need to balance out, okay, how many deaths versus what period of time are we supposed to completely stop all of American life and throw 30 million people out of work and pay for everybody's bills on the back of debt that we're never going to repay and inflate out of? Those are all public policy debates. What is making me insane is the notion that we are all supposed to give up our liberty indefinitely without any sort of plan for getting out of it, without any sort of metrics for how we are even supposed to tell when we get our liberties back, and without any sort of understanding of the data itself. It's as though the absence of data has become a cover for the authoritarianism. And that's when I start to go crazy. Now, I will say that I think that President Trump being the president has helped with a lot of this, because it is very obvious that Trump does not want this lockdown to go on for 10 seconds longer than is usual, right? He does not want this to be happening. I admit that I would be a lot more suspicious if a Democrat were in charge, because the tendency there is toward shutting down business and paying people and transforming the nature of American government. Trump obviously does not want to be in this situation. So maybe he is not making all the right decisions. Maybe he needs better information. Maybe he needs a more nuanced take on how all of this works. But I at least don't suspect his motives in the middle of this lockdown. But as this goes on, I was just noticing that in Los Angeles, right? I was out of the news for the last couple of days. I was noticing that Eric Garcetti, the mayor of LA, put his stay-at-home order on the books until May 15th. And I'm just thinking to myself, based on what data? How are you even doing that? Based on what data? At that point, I start to think to myself, no, May 1st, people are going to start to go back to work. People are going to start ignoring this stuff, because people can only quote unquote rely on the experts as long as they feel like the experts either, one, know more than they do, or two, have a plan for knowing more than they do. Right now, it doesn't feel like the experts know significantly more than they do. And it doesn't seem like the experts have a plan for knowing more than they do. So people are I think, correctly getting upset with all of this, which should spur the experts to come up with some better metrics for how we figure out how to get out of this thing and what a plan looks like. And they better do that in short order, because I promise you that the longer they go with the trust us routine, and the longer Americans are saying, well, hold on, my life's work has been put on hold. I'm supposed to just sit home with my kids and shelter in place until when? 18 months from now, when there's supposedly a vaccine?
I just see a lot of people buying into the, hey, stay at home, this is going to save lives. And they're just giving up their freedoms, no questions asked, and that's what really concerns me. That along. Now, again,
I think that people. I understand people buying these stay-at-home to save lives for now, because that's true. It is saving lives in the here and now. The question is, over the long term, is it going to save lives? And we need data on that, like ASAP. And if that data isn't forthcoming, eventually people are going to get just tired of this. My parents are 64, 65, and they are basically ready to walk out of the house now. Like my mom,
right.
I basically have to.
They do need to stay at home, but it's like, at what cost? Because there's a lot of different data out there. You read about causes of death being attributed to COVID when it's really something else. So there's a lot of conflicting data out there as well. And just what really concerns me is all this information online, people that are just accepting it, saying, "Hey, we need to do this. This is safety." And I believe Ben
Now, again,
Franklin said
I think that
those
the
that would give
problem
up.
is, Mark, again, I think that the problem is that people who are saying we need to do this are not adding the words "for now." If they add the words "for now," I'm like, okay, understandable. If they're just saying we need to do this, period, then I think they fundamentally misunderstand what exactly the information is out there, which is that the minute that we go out there and we start associating with each other, there will be hotspots again. There will be people who are infected. There will be a second wave of infections. And that's what I have objected to all along in these models is they keep saying, well, 61,000 dead if we really hold to this. Yeah, by August 1st, and then the models don't continue beyond August 1st. What the hell are you talking about? Mark, really appreciate the call and definitely appreciate the concern. Yaakov, calling all the way from Israel. You're on the Ben Shapiro Show. How's it going, Yaakov?
Hi, Ben. Chag Sameach. I hope you and your family are all well. So I just want to know, you talk a lot about how the infection rate is probably a lot higher than, the confirmed cases. If that's so, then wouldn't that send the death rate, plummeting, giving us more reason to be hopeful and, less scared? And if that's the case, would that mean that we'll be able to lift restrictions sooner than we had originally thought?
That's sort of the hope, right? I mean, I've been wondering all along whether this case fatality rate is wildly inflated, and also how it adjusts for population. Right? Is it adjusted for age? Is it adjusted for pre-existing condition? Because we are going to have to tranche the populations to pretend that we're going to treat a 30-year-old healthy person the same way we treat an 80-year-old person who's already had radiation therapy for cancer is just idiotic. Like that's not a real thing. And it's also a big difference between whether if case fatality rate is 3.54% in reality, and this thing is highly transmissible, then you do have to talk about, okay, exactly how do we continue to operate as a society in I think, much more restrictive ways than if the case fatality rate is 0.3%, and it's 3 times as deadly as the flu, but a lot more transmissible. And when you get to younger populations, it's basically as deadly as the flu, but more transmissible. Right? Then you're just talking about social distancing and don't go to big crowds and wash your hands a lot and don't touch your face. I mean, that's really what you're talking about. So, yeah, I mean, I've been urging data. And frankly, I'm shocked the federal government has not rolled out any plans to put forth data, that state governments have not rolled out any plans. It's basically been left to private institutions to do this sort of data mining. I mean, I know a couple of different people who are working hard on putting together private data studies. How is it the governments haven't made this top priority so they can even analyze what are the factors that go into the decision-making, Yaakov? It's crazy. Now, I have to ask you, Israel's been completely locked down. During Passover, for those who don't know, Israel not only locked down, they basically locked you in your house. You weren't allowed to go outside. You weren't allowed to go to anybody else's house because they were afraid people would just walk across the street to somebody else's Seder. Yeah, so what is the situation now? It's Chol HaMoed over there.
Right. Look, it's very strange. Obviously, Israel is at its peak of livelihood, and everyone's active during Chol HaMoed Passover, and now it's just completely dead. You can't leave your house without a mask on. Only essential reasons. I left my house today for the first time in a month to go pick up my sister, who's a soldier from Jerusalem. So it's very restricted. It's you can't leave your house. There are fines. There are police everywhere. It's very strange.
Yeah, I mean, it is an incredible situation across the globe. Yaakov, really appreciate your call, and hang in there. Hope that you're having a decent Passover despite all of this. Alex in Pennsylvania, you're on the Ben Shapiro Show. Go for it, Alex.
Hello, Ben. Thank you for having me again. My question is for you. I don't really hear you talk about this issue at all, same as Crowder, but what is the conservative view on the death penalty?
So the conservative view on the death penalty is that in principle, there's nothing wrong with the death penalty. There are questions about the application, meaning it is unevenly applied. We don't actually know when it is applied, but the idea that there are certain people who deserve to die, I think, is true without question. I mean, people who rape and kill children should die. They have no right to live. They should not be breathing the same air as the rest of us. With that said, the general state application of the death penalty has been incredibly uneven. It has been too sparse, actually, if you're going to treat it as an actual regular part of the criminal justice system. And that does raise questions about whether it ought to be applied at all if it's going to be applied so unevenly. Alex, appreciate the call. Leon in Colombia, you're on the Ben Shapiro Show. Go for it, Leon.
Yeah, you often talk about the single-payer Medicare system as being completely evil. And when Bernie brings it up, he goes, it's Denmark. And you go and you point out, well, they also have private health care. Now, I noticed that you never talk about those two-tier systems and why or why not that couldn't work inside the United States. Can you speak to that a little bit?
So there is a two-tier system in the United States, right? We do have Medicaid. We do have Medicare. You do have emergency care. right? So if you walk into an ER, you will be treated. And then you have the ability to pay. So the idea of a two-tier system in which you have a basic level of healthcare guaranteed, and then you have a secondary system in which you can purchase better care, that actually exists in places like Singapore. And I've mentioned Singapore as a possible alternative to the United States model. It would actually be clearer than the US model, since the truth is that we are sort of filtering public costs through private systems by upcharging people who have private insurance while downgrading people who have, Medicaid, for example. So it's a very sort of, we have a bizarre mixed system. One of the great lies about America is that we have a highly privatized system. We have a privatized system in some ways, but the vast minority, if not majority, of people who are getting healthcare have that subsidized in some way by the federal, state, or local government. So that is, it's important to recognize that America is indeed a mixed system and not a pure private system before you even get into, should it be just a pure two-tier system? I think there's a case to be made that if you're going to have the government involved at all, the government should basically cover only emergency care. If you wish to, pay out of pocket for other care, for more expensive care, then that's something that you should go ahead and do. And that most care should actually be point of contact. That if you want to pay out of pocket for a flu diagnosis, that you should be able to do that without even reference to insurance. That seems like that might be worthwhile. That's something at least I am open to. I appreciate the call, Liam. All righty, coming up, we're going to take more of your calls at 855-236-3228. That's 855-236-3228.